Hello everybody, my name is Peeter Ross. I'm a physician working in Tallinn, but also I'm an associate professor in Tallinas University of Technology, doing research about e-health and also about healthcare engineering. I have pleasure to share with you today some experience from Estonian healthcare organization and implementation of e-health services in Estonia. As I have told, then Latvia faces quite radical changes in healthcare taxation. And your aim is to give more responsibility for the citizen and to link tax paying and healthcare services with each other. This is exactly the way how Estonia has done some 2 decades ago, when we separated health insurance tax from the rest of the taxes paid by either employer or employee. So currently the funding of Estonian healthcare through health insurance, which is compulsory insurance and funded by the health insurance tax. Health insurance tax is 13% added to the brutto salary, and this is paid by the employer. If the person gets 100 units of salary, then upon of that, employer pays 13 units for health insurance. And we have seen that linking tax paying and health insurance together has been the decision what has brought us transparency in healthcare, but also interest and actually kind of must to pay for a citizen to pay taxes, because not paying a tax one couldn't get any health insurance. Looking the plans how Latvia would like to go with healthcare reform, then I see that linking health insurance to to the tax paid by the person, by the employee, is definitely the way how to make healthcare more transparent, and also give some kind of responsibility about his or her health to the citizen itself. What do I mean by that is collecting money what is dedicated for healthcare gives both for healthcare centers, general practitioners and hospitals clear understanding what will be their annual budgets, what is the money which could be used for healthcare during the next year. But important also to underline that also citizens could then see transparently where goes their tax money and how this is used to take care of their health or some chronic conditions or some acute diseases. What is important to underline also is that health insurance should be based on solidarity, which means that one shouldn't get healthcare services based on the amount of money what he or she has paid as a tax, which is obviously the way you go in Latvia. And the other good thing in this kind of tax collection is that you can pool resources, which means that there is a dedicated fund for healthcare, probably also for pharmacies, medicine, and depending on the decision and the content of the bill for disease prevention or some other preventive measures. What could be the next steps in healthcare organization after reforming taxation and forming a clear budget for the whole healthcare is connecting patients or citizens' health data to each other. It's called either health information exchange platform or nationwide electronic health record. This is also something what has been introduced in Estonia. So currently we have all healthcare providers connected into the same nationwide health information system, which means that if a patient goes to the GP and then is admitted to a hospital, then in hospital we can see several documents what actually has been issued in GP's office, and vice versa. When a patient is discharged from one hospital, then also other hospitals will see case summaries or exams or prescriptions what has been issued in the previous hospital. One service what I really would like to highlight is e-prescription. This was introduced in Estonia in 2010. Today, less than 5% of prescriptions are issued on the paper, which means that more than 95% of prescriptions are issued in electronic form. This is very well accepted by all parties in the healthcare, meaning that patients love it, physicians like it, and also pharmacists are their attitude is very positive towards electronic prescription. Obviously, the effect for doing less mistakes is clear, and another thing that one hasn't carry paper prescriptions with himself, but the prescription is uploaded in the prescription center, where it could be downloaded then in any pharmacy in Estonia. person has just to show his or her ID card or ID number, and then the prescription is downloaded and medication is disseminated. This kind of universal health exchange I think could be also done only if you have clearly resources dedicated for healthcare. Important issue also is to connect healthcare e-services to other e-services used by society. In Estonia we can give this kind of examples like e-school, where I can follow my children progress through internet every day, daily, or tax authority to get refunding of my previous year's taxes, or currently we have local government elections, so we can vote electronically. So all those services what are used widely by public are of course kind of support also e-health services or e-services in healthcare. So I wish you really braveness to make hard decisions in reforming your healthcare taxation, and basically also healthcare organization. I hope we can work together in the future as much as possible to share our experiences, and if there is anything we can do to introduce Estonian experience regarding either healthcare funding reform or digitalization of healthcare, then I would be really happy to do this. Thank you very much.